Hello everyone, my name is Alexis Jones, and today I will be discussing the benefits of adherence to medications. So to understand what medication adherence is, you must first understand what non-adherence to medication is. The National Institutes of Health identifies non-adherence to medication as a complex and multi-dimensional health problem. This may be in direct relation to the patient, to the treatment, or maybe the lack of communication between the patient and the provider. There are two categories of non-adherence to medication. And the first category is unintentional non-adherence to medication. And that means when someone may not be able to afford a medication, they won't be able to purchase it and take it. Or if someone forgets to take their medications as prescribed or forgets to fill it at the pharmacy, that can lead to gaps in therapy. And let's say someone is from a particular socioeconomic status or suffers with illiteracy, it may be hard for them to read the prescription bottles to know how to accurately take their medications. Intentional non-adherence to medication is when someone makes a conscious decision to not take their medication. And that may be for personal reasons. Maybe they believe the medication won't help them, or they're afraid of side effects. Sometimes people will resort to complementary and alternative medicines, also known as CAMs, and that includes Chinese medicines or herbal supplements and forms of medicine that you can purchase at your local, behind the counter at your local pharmacy. So with that being said, the consequences of non-adherence include increased hospitalizations, deteriorating and prolonged and complications from disease states and chronic illnesses, and also increase in the cost of healthcare. Maine's Public Health Agency provides a good analogy on how uncontrolled chronic illnesses can impact the cardiovascular system. And I would like to share that with you today. So everyone, please close your eyes. And I want you to just imagine the pipes in your home. High blood pressure is like having high pressure in a pipe. It damages the pipe, but you often don't see the effect high blood pressure has on the body. Our blood vessels work much like the pipes work to transport water throughout our house. Untreated conditions apply pressure to the blood vessels, which can eventually rupture or burst, leading to what the American Heart Association calls, please open your eyes, the hemorrhagic stroke. As you can see right here, this blood vessel is swollen. When it ruptures here in the brain, and this can lead to a permanent disability or even death. So now that you understand what non-adherence is and the consequences or the potential consequences to non-adherence, I can imagine you must be wondering, what is medication adherence? How does it affect me? How can one become adherent to their medications? And these are all valid questions. The National Institute of Health defines medication adherence as the extent to which patients are able to follow the recommended or recommendations for their prescribed therapy. Okay, how does this benefit me or you or us? Well, there is an increase, or a decrease rather, in hospitalization, a decrease in the cost of healthcare that is spent. Also, there is a deduction in complications that result from the chronic illnesses being untreated or unmanaged. And so now you must be wondering, okay, you explained to us how people can be unintentionally non-adherent, What ways can people become adherent? How can I become adherent? So more recently, providers and healthcare providers or physicians are being trained in how to identify any barriers to change for patients and counsel them, help them better understand their therapy, their regimens, and how they help. Also, the Centers for Medicare and Medicaid Services sponsor programs like medication therapy management that uses trained pharmacy professionals to provide motivational interviewing for patients to address any alerts or conditions that might affect the patient, to counsel the patient on any concerns about potential side effects, to possibly reduce polypharmacy, which is using multiple pharmacies, also addressing any gaps in therapy, and maximizing the patient and provider outreach, and also optimizing therapy for patients. In conclusion, we all benefit from medication adherence either directly or indirectly. Maybe you know someone with a chronic illness, or you have a loved one who has a chronic disease, or you work in healthcare, possibly you have a chronic illness. Chronic illnesses can be maintained and controlled with medication adherence and reduce complications and even death. Making medication adherence ensures that patients receive the most benefits from their medicines, live healthier lives, and also reduce the cost of healthcare. So I want to open the floor now for any questions.
I have a question. Who do we go to if we decide we want to try to get more information about how to take our medicines? I don't know because we cannot, maybe, like you said, we cannot read. Who do we call? Is there an association out there that many people who may not know about it can call so that we can get information?
I would say the first step would be to reach out to your primary care physician, because they're more intimate with your care. They know your family history, your health. They can sit down with you one-on-one and be more intimate. And also your local pharmacist, if you have any concerns about your medications, the side effects that could affect you, or any drug interactions that you're afraid might happen, you can always reach out to your local pharmacist or your primary care physician. Did you have a question, sir?
Well, that kind of basic kind of sums it up when you just asked. I mean, if I do, I get, they're gonna give me like the side effects and stuff like that, but they're not gonna explain it like how you just explained it to me, like as how deadly it could possibly be in that situation and medication. So.
Yeah, so medication adherence is very important in just managing and controlling disease states and preventing hospitalizations, extra medications, because if you think, if I have one condition and now I get another one, now I have more medications, I have more provider visits, and it's more cost for all of us. Any questions?
Yes, can you go on the computer and find out some of the information we're talking about?
Yes, you can also find out some of that information, but if you have any questions, like serious concerns, it's always important to reach out to your doctor so that you can understand how to take your medications and you know that you're taking your medications as prescribed. So thank you so much for your time.
All right, thank you.
You got a rest?